Vulval cancer is a rare form of cancer that affects the external part of the female genitalia, known as the vulva. This area includes the labial lips of the vulva, clitoris, vaginal opening, and the skin around the genital region. Vulval cancer typically develops in the skin cells of the vulva and can be aggressive, but it is treatable if caught early. Risk factors for vulval cancer. Several factors can increase the risk of developing vulval cancer, including human papilloma virus HPV infection. Certain strains of HPV, particularly HPV types 16 and 18, are linked to a higher risk of vulval cancer, similar to their association with cervical cancer. Age. Vulval cancer is more common in women over the age of 50, especially those who have gone through menopause. Chronic inflammation or infection. Conditions like lichen sclerosus, a skin condition causing thin, white patches of skin, can increase the risk of vulval cancer. Weakened immune system. Women with compromised immune systems, such as those with HIV/AIDS or who are taking immunosuppressive medications, may be at a higher risk. Smoking. Smoking has been linked to an increased risk of several cancers, including vulval cancer. Previous cancer. A history of cervical or vaginal cancer can increase the risk of vulval cancer, especially if linked to HPV. Genetic factors. Though rare, some genetic syndromes, such as Lynch syndrome, may increase the risk. Symptoms of vulval cancer. Vulval cancer can cause a variety of symptoms, some of which may be mistaken for less serious conditions. Common signs and symptoms include itching or pain, persistent itching, burning, or pain in the vulva area, often without a clear cause. Lumps or bumps. A noticeable lump, bump, or swelling in the vulva, which may feel firm or hard. Changes in skin color or texture. The skin may appear thickened, red, white, or ulcerated, sometimes with a worm-like appearance. Bleeding. Abnormal bleeding or spotting, particularly after sexual intercourse. Painful urination. Pain or discomfort while urinating, which could be caused by the tumor pressing against the urinary tract. Discharge. Unexplained discharge from the vulva, which may be bloody or have an unusual odor. Diagnosis of vulval cancer. If vulval cancer is suspected, your doctor will perform a series of diagnostic tests to confirm the presence of cancer. Physical examination. The doctor will inspect the vulva for any abnormal lumps, discoloration, or other changes. Biopsy. A small sample of tissue from the suspicious area is taken and examined under a microscope to check for cancer cells. Colposcopy. In some cases, a special magnifying instrument is used to examine the vulva more closely, especially if HPV-related abnormalities are suspected. Imaging tests. If vulval cancer is confirmed, imaging tests such as ultrasound, CT scans, or MRI may be performed to check if the cancer has spread to nearby lymph nodes or other areas. Lymph node biopsy. If the cancer has spread to the lymph nodes, a biopsy of the lymph nodes may be needed to determine the extent of the disease. Staging of vulval cancer. Vulval cancer is staged based on the size of the tumor and whether it has spread to nearby lymph nodes or other parts of the body. The stages range from stage I early stage to stage IV advanced stage. Staging helps determine the most appropriate treatment options. Treatment of vulval cancer. The treatment for vulval cancer depends on the stage of the disease, the location of the tumor, and the woman's overall health. Common treatments include surgery. Surgery is the most common treatment for vulval cancer. The goal is to remove the tumor and any surrounding tissue that may be affected. In some cases, this may involve removing part or all of the vulva, a procedure called vulvectomy. If the cancer has spread to the lymph nodes, those may also be removed. Radiotherapy. Radiation therapy may be used after surgery to destroy any remaining cancer cells or as a primary treatment if surgery is not an option. It may also be used if the cancer has spread to lymph nodes. Chemotherapy. Chemotherapy is used less frequently for vulval cancer but may be an option if the cancer has spread to distant parts of the body. It may be used in combination with surgery or radiation. Topical treatment. In some cases, the topical medication may be applied directly to the affected area if the cancer is in its early stages and localized. Immunotherapy. Emerging treatments, such as immunotherapy, are being explored for advanced cases of vulval cancer, especially for those with HPV-related cancers. Prognosis. The prognosis for vulval cancer depends on the stage at which it is diagnosed. If detected early, the prognosis is generally good, with high rates of successful treatment. However, advanced stage vulval cancer can be more difficult to treat and may require more extensive surgery or other therapies. Stage I. The cancer is confined to the vulva, and treatment is often highly successful. Stage III. The cancer has spread to nearby tissues or lymph nodes, but treatment can still be effective. Stage IV. The cancer has spread to distant parts of the body, and the prognosis may be poorer. Prevention. While there is no guaranteed way to prevent vulval cancer, certain steps can reduce the risk. HPV vaccination. Vaccination against HPV can help protect against the strains that cause vulval and cervical cancer. Regular screening. For women at high risk of vulval cancer, such as those with lichen sclerosus or HPV infection, regular UPS and monitoring can help detect abnormalities early. Avoid smoking. Since smoking is a known risk factor for several cancers, quitting or not smoking may help reduce the risk of vulval cancer. Prompt treatment of symptoms. Addressing symptoms such as persistent itching, abnormal discharge, or pain early can help ensure early detection and treatment if cancer is present. When to see a doctor. You should see a doctor if you experience any of the following symptoms: persistent vulval itching, pain, or discomfort, unexplained lumps or changes in the appearance of the vulva, abnormal bleeding, especially after sex or menopause, pain during urination or intercourse. Vulval cancer is rare, but it's important to be aware of the symptoms and seek medical attention if they occur. Early detection and treatment can improve the outcomes and quality of life for women affected by this condition.